Welcome to Through the Eyes of She, Equity in Health, Education, Business, and Leadership for the African Woman in the 21st Century. Please utilize the chat and Q&A features on the side of your toolbar. Please use the Q&A feature to submit any questions for the panelists. This session is being recorded. Thank you.
Hello, everyone. It's my honor to introduce our next session of the conference, Through the Eyes of She, Equity in Health, Education, Business, and Leadership for the African Women in the 21st Century. My name is Dr. Lydia Barakat, and I am an Associate Professor of Medicine in the section of Infectious Disease, Yale School of Medicine. I had the privilege to collaborate with Dr. Dan and Christina and others on a project led by Dr. Onyema Abwagu to enhance workforce development in Liberia in primary care, infectious disease, and HIV care. We created a pathway to train providers in internal medicine, infectious disease, and HIV. I had the pleasure to spend some time in Liberia, Monrovia, at JFK Hospital prior to the COVID pandemic. And I had the honor to meet exceptional healthcare workers, physicians, educators, students, and trainees. Again, it gives me a great privilege to introduce the next session entitled Successful Women-Led Medical Education Capacity Building in Liberia. This session is going to be moderated by Dr. Sheila Shenoy, and our panelists are going to be Dr. Christina Tabler-Slagle and Dr. Bernice Dan. Dr. Sheila Shenoy is an assistant professor of medicine in the AIDS program of the section of infectious disease and associate director for the Office of Global Health at Yale School of Medicine. In addition to treating patients with infectious disease, where I have the pleasure to work with her, and strengthening training of students, residents, and fellows, she conducts patient-oriented research to improve outcomes from tuberculosis to HIV in resource-limited setting. She evaluates strategies to improve diagnosis, linkage, and retention to care, with a particular interest in exploring the role of community-based services in community health workers to facilitate implementation of TB and HIV prevention. Our panelists are going to be Dr. Bernice Dan. Dr. Bernice Dan has over 20 years of experience as a public health physician, policymaker, administrator, and educator. Dr. Dan has served as the Minister of Health for the Republic of Liberia. Prior to her post, for 9 years, Dr. Dan has served as the National Chief Medical Officer for Republic of Liberia since the end of Liberia's second civil war. In these roles, Dr. Dan has led the re-establishment of the Ministry of Health and the rebuilding of Liberia's post-conflict and post-Ebola healthcare delivery system. Internationally, Dr. Dan is a board member of the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and also serves on the board of the World Bank's Global Finance Facility. As part of rebuilding Liberia's national health system, Dr. Dan has prioritized the development of Liberia's health professionals' education system, including in 2013, she spearheaded the establishment of the postgraduate medical residency programs in general surgery, pediatrics, internal medicine, and obstetric and OBGYN. During the early stages of Ebola virus outbreaks in 2014 to 2015, Dr. Dan coordinated the national response to the epidemic, including development of treatment protocols and infection prevention and control standards, training, resource mobilization, and partnering coordination upon establishing of the incident management system. She also focused on a community-based initiative and restoration of routine health services. The post-outbreak, Dr. Dan oversaw the development of Liberia's investment plan for building a resilient health system. Dr. Dan has served as an educator at the University of Liberia and John Kennedy Medical Center and Cuttington University College of Health Science. Owing to her roles both in government and academia, She has in-depth experience not only assessing, but also implementing improvements in the healthcare system and policies. Dr. Dan has a substantial resource portfolio and has published in many globally recognized journals in partnership with researchers and policymakers from Liberia and around the globe. Dr. Dan is the winner of World Health Organization in 2016 International Health Workforce Award, and in 2017 University of Washington Distinguished Alumni Award. In April 2018, Dr. Dan assumed the role of Vice President of the University of Liberia, heading the College of Health Sciences. The college will house the nation's only medical school and pharmacy school, and will establish a new school of public health and school of nursing and midwifery. Dr. Dan, of course, has a medical degree from the University of Liberia, a College of Medicine, and the master's degree of public health from the University of Washington School of Public Health and Community Medicine. She is a foundation fellow of the Liberia College of Physicians and Surgeons, and a fellow in the West African College of Physicians. I can go on and on introducing Dr. Dan. And last but not least, I have the pleasure to introduce Dr. Talbert Stagel, who is an assistant professor of general internal medicine at the Yale School of Medicine, a core faculty member at the Equity Research and Innovation Center, and an associate director at the Yale Institute of Global Health. She is a global health scholar and educator focused on addressing global health and educational disparities through high quality interactive teaching and locally appropriate and responsive scholarship and field programs using the interdisciplinary perspective. Dr. Talbert Stagel is part of a long-standing, trusting partnership with colleagues, including Dr. Dan from the University of Liberia and Liberian Ministry of Health, to establish permanent academic programs and systems to fulfill Liberia's goals for strengthening its health workforce. She is the principal investigator of Bridge U, Applying Research for a Healthy Liberia, a 5-year, 15 million collaborative project with the University of Liberia and Vanderbilt University, funded by USAID, which will establish a center of teaching and learning and innovation, as well as a permanent academic and financial management system at the University of Liberia College of Health Sciences. She is also the faculty director for health management and preclinical education workforce capacity building programs in Liberia, collaborating closely with colleagues at Yale, like ourselves, and in Liberia, and the Yale led for an undergraduate medical education curriculum review at Liberia's only medical school. It's really an honor to send the podium now to Dr. Sheila Shenoy.
Hello, everyone. Thank you so much, Dr. Barakat, for that introduction. And thank you, Dr. Talbot Schlegel, and Dr. Dan for being here today. And thank you to the conference organizers for making today possible. I had the privilege to contribute to training doctors in infectious diseases at JFK Hospital in Monrovia for 2 months in 2018 as part of the workforce strengthening program that Dr. Barakat mentioned. And so I am so thrilled to have the opportunity to speak with Dr. Dan and Dr. Talbot Schlegel about their careers, their collaboration, and improving medical education in Liberia today. I hope to have a few minutes for questions at the end of this session, but we'll also have a session just after this where we will have the opportunity to hear more from our panelists. So let's get started. Dr. Dan, you were Minister of Health during a very turbulent time in Liberia's history, and you are now the University of Liberia Vice President overseeing the College of Health Sciences. Can you briefly describe your career path and how gender may have affected your path?
Okay, thank you, and good afternoon to everybody. I recall my early education, which I really did not focus on, or I didn't even know anything about gender at the time. But I had a role model my aunt, who was a nurse, and I wanted to be like her. And so that motivated me into the pathway in which I am today. So I started my education early in the sciences, planning to be a nurse. And on that journey, I realized that I could even do something higher and go higher. So I decided to be a medical doctor. In college, just when I was admitted into the medical school, the man I was dating decided to leave. I guess he was not comfortable. I was going higher. Anyway, I entered medical school and then went through. I didn't realize any gender issues at the time, but I started noticing the gender issues during the practice. When we were in the hospital and it was during the war years, I had colleagues that will say, you saw your friends going to nursing school and you decided to come here. And so we will do the work equally. I guess for them, they felt that there were times I was going to ask them to help me, but that was not the case. We did the work equally. Especially when it comes to surgery, because we're also taught how to do the basic cesarean sessions, the emergencies, surgical emergencies. And those days, there were very few of us who were available. And so it meant staying in the OR for hours. Sometimes you go for 24 hours without coming home. And then others will say, well, the way you work, you don't look that way. For them, I appear to them to be frail because I was a female. And they didn't expect me to work equally the way we worked in the hospital. But we did that. So that went well during the clinical practice. Now the political positions. There where the actual challenges were. From the initial stages, when I was appointed as the chief medical officer, at the time I was the advisor to the Ministry of Health on Reproductive Health from UNFPA. And there were colleagues who came to me and told me, females, and said, you are working, you are making your own money, you are going to the government, and for months you will not take pay, you need to think about it, you'll be looking up to your husband to support you. But that did not change my mind. I went in with an open mind. I had a boss who was also supportive of female leadership. And so for the first, we were there for the first term, which was 6 years, and it went well. And then the second 6 years. And that was like, people knew, it was the first 6 years was like rebuilding the health sector. And so we had worked very hard, putting systems into place, and things were moving well. That's the time the males knew that females were not supposed to be in that position. So it became a political struggle. They will go and meet political leaders and misrepresent you. And it was all because they wanted positions. But I was focused on the work. I did not bother myself with that. I also found strategies to work around it. And that went well. So for me, the gender influence on the job was mainly with the political appointments and the political positions. You did mention the establishment of the Liberian College of Physicians and Surgeons. And I recall from the initial stages, I pulled some colleagues together for us to brainstorm, think through, and then started the work. And there was a particular senior colleague who was always praising me, Dr. Dan, you need to document this. This is historical. That was a male. But the work was so much so, except for the policy documents that we will write and write background on how we started and things like that, we were not documenting. The first person who was appointed as the head of the Liberian College of Physicians and Surgeons was also a female. It was a tenure position. So after her tenure, this other male took over. When he took over, he decided he would push all the females. It became a struggle between him and his predecessor and other females who worked to build a team and who were actually working in the office with him. It even became a struggle between him and some external partners who came to help, who were females. And being in the loop from starting, it was difficult to stand by and watch. So I was also in there. I recall his first commencement convocation. He did a whole booklet, took the credit for himself and one other male, and how he established the school and did not recognize any one of us. Fortunately, and that was distributed widely, because it was distributed during convocation program ceremony. So one of our colleagues who was on board, a male, who started the process, who was in the beginning with us, also said, but did you see this? I said, I saw it. And he said, no, I will not take this. So he went inside that and he wrote another long thing to counteract. But that is to tell you that there are also males who just don't want to see the females moving forward and moving ahead. They will even take your work and take the credit for it, and they will do everything to bring you down. So in a nutshell, those kind of things do exist within the professional career. It is good to be aware of them. You position yourself to be successful. I'm a very determined person, and that is one of my strengths. I don't give up easily. And so as it is happening, you are also strategizing and positioning yourself to be successful. Thank you.
Thank you, Dr. Dunn. I took away a lot from that. There was several stories I hadn't heard before, so I really appreciate you sharing a lot of that. I'm trying to keep mindful of time, and so I want to turn to Dr. Talbert Slagle. Can you describe how you and Dr. Dunn came to work together? How has this international collaboration been maintained, and what do you do to make sure that it thrives?
Sure. Thank you, Sheila. Let me just say thank you for having me here. It's such an honor to be in a panel with Dr. Don, who is my hero in really every imaginable way. So just to start how we began working together, there was a relationship between faculty at Yale and Dr. Don and others at the Ministry of Health prior to my having the opportunity to meet her. And I'm grateful for that. My former mentor, Betsy Bradley, had worked closely with Dr. Don on some health management workforce capacity building programming. So when Dr. Don was leading the health workforce strategy program that she described at the end of the Ebola crisis, when she had become Minister of Health, she invited Yale to support that work and help her team implement the strategy. And so I had the opportunity to be part of that team, and I traveled to Liberia at the end of 2015 and met Dr. Don for the first time when she was Minister of Health. And our team had put together a proposal of how we might support the health management component of her national health workforce strategy. And we presented to her, and I was very nervous. I'm not sure I've told Dr. Dunn that before. And, you know, I had heard wonderful things about her, and you can tell from hearing her talk how absolutely amazing she is. And I think she was satisfied with the proposal that our team had put together, and she said, go ahead and do the work. And so we continued to build on that work. I also had read closely the health workforce strategy and noticed a focus on a need for preclinical basic science faculty at the only medical school in the country. And I have a PhD in basic sciences, and then after that moved into health systems strengthening. So I said, maybe I could be helpful. I also really love teaching. Maybe I could be helpful in the medical school work as well. And so I offered that, and Dr. Dawn asked us to do a study of what were the needs and challenges of medical students at the only medical school in Liberia. And so we did that, and we found a lot of needs and challenges. And Dr. Dawn helped us design the survey, and she was engaged. I worked with students at Yale, and then she also assigned a medical student from Liberia to our team. And I think one of the things that's been an important signature feature of our partnership, one thing is that we follow the lead of Dr. Dawn and other senior leadership in Liberia. She's senior to me in every imaginable way. I'm very comfortable with that. I'm very comfortable looking up to her and following her direction. And we make sure that everyone on our team is the same. And it's not difficult. It's inspiring to work for her. So we presented, we came back to Liberia. I think I came with maybe one other, and we had the results of this study we had done at the medical school, and they were pretty sobering. And I don't think it was a surprise to Dr. Dawn or the dean of the medical school. But I was, again, very nervous. And I actually said, I'm nervous about presenting these findings to you. I'm aware that I'm an outsider. I don't think I would like it if an outsider came to my institution and presented negative findings about my institution to me. And I just want to say that out loud. And she and the dean of the medical school essentially said, well, how can we improve if we don't know? And I thought that was amazing. And I think that has really been the tone of our partnership. I think we're very honest with each other. We talk about things. I try really hard to name things that sometimes we don't always talk about in these kinds of partnerships and collaborations. I talk openly with Dr. Dawn about following her lead and being junior, and yet also being the lead on this big USAID grant we got and how to navigate all of that. So I think that that's been an important feature of our partnership. She may have other perspective on that, but I think we trust each other. And I try really hard to be open and honest, and also to defer to her leadership and the seniority of our partners in Liberia. They're the ones who set the goals and strategy. They tell us what we need. And I should say, I learned from Betsy Bradley, who I mentioned, the approach that I like to think about is to come and say, how can I be helpful? How can we be helpful? And then they tell us, and then we do that, or we try to.
And that's fantastic. Thank you for sharing and being so honest about how the two of you work, how this collaboration has been so successful. And I think it's very interesting how at the direction of Dr. Dawn and her colleagues, that you basically did a needs assessment, right? You came in and kind of assessed what the current status was, and based on that information, you were able to move forward and design training programs that would meet those needs. And I just wanted to move forward from there and turn back to Dr. Dawn. And I've heard that in very public international forums, you have described this partnership as an appropriate model for collaboration. And I'm hoping to hear more about that. I'm not sure if Dr. Talbot-Schlegel started to discuss how she takes lead from your direction, but I'm hoping to have you elaborate more on what this collaboration means and how it's been so successful.
Okay, thank you. Coming from the war years and building the healthcare delivery system, we I have the experience of having partners come in with programs that are already designed. And sometimes they don't even stop by the Ministry of Health and go directly into counties and start implementing. And then when the program is about to end, they come back to the ministry, and then that's the time we start discussing sustainability of the program, which most often is too late to talk about. And at that time, the Ministry of Health is not in a position to sustain the program. So with that experience, I worked around partners working with us to design programs from the beginning so that we will all know what we put in it. We drive the process, so we prioritize what is important for us and what our actual needs are. And then we work on implementation together. It is always good to also recognize that we all have our weaknesses. And once you realize that and you put your weakness on the table, you have others who will be able to help you to build you up. So I've always worked that way. So with this partnership, at the beginning part of the vice president of the College of Health Sciences, we have a number of US-based institutions with research projects, wanted to implement research activities in Liberia. So we quickly talked to some of the key partners and organize everybody into a team able to coordinate everybody. And we call that team routine. It meets every 2 weeks to update one another. That way, one activity complements another. We don't duplicate activities, but most especially also we identify where we have challenges, where we have needs. And if there is a call for proposal, for example, we work together to present that proposal and build in some of our needs jointly. Like the way we have the Bridge U. We have been working on strengthening medical education over the past 2 years. And this is one of the beauty of having the team together. We have worked with faculty from Yale and Vanderbilt to revise the medical school curriculum from a 9-year after high school to a 7-year after high school. The study that Christina referred to, that study also picked up the fact that there was a lot of attrition from medical school. And students actually stated why people were dropping out of medical school. Our last vacation, our last graduation, that class entered with 73 students, and at graduation, they graduated 26. Yes. And so that takes us back to some of the things that the students said in their report. They were concerned about the quality of the education. They were concerned about not having enough faculty. They were concerned about living conditions and a whole lot of things. So you could actually tell why people were dropping out of medical school. So then we decided to take that study and actually use the results to improve the education and improve retention. And the good thing about that study is that it is student study, Yale student plus AMWT students. So it's the student results that we are using to improve the medical education in Liberia. I will not go into details of that study, some of the components, but that's how the partnership was built. We believe that as a country, we should provide a leadership for some of these things so that our actual needs are met, so that one day when Liberians hear the USAID spent $15 million on the College of Health Sciences, they can see the results as compared to things happening we don't know and we can really lay hands on it. Thank you.
Thank you, Dr. Don. I wanted to ask you both, your current work to strengthen the undergraduate medical education in Liberia at the one and only medical school, as both of you have alluded to, has included a goal for women to make up 50% of admitted students. And you have incorporated innovative plans for recruiting females from throughout the country. And I believe that includes a summer science camp for high school students. And I'm hoping you can tell us why this emphasis on making sure there's parity at the beginning of medical school is important to you, and but also like what the response has been to those plans that you've been making. I'm not sure which one of you wants to go first, but
okay, let me start, and then Christina can complement what I say. Okay, so we all know that women are capable of going through medical school and becoming good doctors. And we have a lot of experiences in all our countries. I can remember when we were designing this particular project, the first thing is the gender portion of the project design was a requirement for USAID. We had co-creation sessions, and the USAID team was very keen on how we were handling the gender component, and they continue to discuss that today. But when we were designing the project, one day Christina asked me, Dr. Dan, do you know that all your monitoring and evaluation officers at the Ministry of Health are males? I said, what? Under my leadership? Then I realized they were all recruited when I was the chief medical officer. It was a male who recruited them. And I guess he recruited them because he felt that our roles are challenging and females might not be able to ride motorbikes to get to some of the most difficult places. And so he recruited males. I actually told him that after it was brought to my attention. So that put me in a position to open my eyes to what will happen in this project. So we decided that normally women, we have our own issues. The project theme is to use research results to make policy decisions. And globally and nationally, we are all working hard to position women. So if we educate women and they know how to use evidence to make decisions, they will be able to promote the women agenda better. So we want to be keen about that in the project and in the program as we move along with it. We also believe that if we prepare them better, they will also go through medical school successfully and come out successfully and be better physicians. And we all know, my former boss used to say that if you want your work done, give it to a woman. And that was a male. So we want our work done. So we ensure that we train women to do the work. Thank you.
I love that. Thank you for sharing that story. Quite an enlightened man. That was your former boss. I really like that. Christina, I don't know if you can comment on what the response has been to some of the plans that you and Dr. Don have been making with respect to these kind of innovations in the medical school curriculum.
Mm-hmm. Sure. So far, the response has been positive. I'm not in Liberia on a day-to-day basis, and the project is new. And I'm sure that we will encounter some challenges in certain circumstances with this part of the project, like all the rest of it. But, you know, I do think that Dr. Don's emphasis on the fact that USAID also emphasizes gender and gender parity is really an important piece. We have really been so thoughtful about trying to understand the challenges in the pipeline in Liberia that make it difficult for women to enter and then make it all the way through. I mean, you can imagine just in the pipeline numbers that Dr. Don cited, I don't know the gender breakdown of the 20, I think she said 26 who graduated from medical school, but there were, you know, 40 something who were lost along the way. And some of those were women, I'm sure. And all of that attrition is challenging. And we want to pay attention to all of it. We also want to pay attention specifically to the unique challenges that are experienced by women and girls. So I want to talk a little bit more about this summer science camp, or vacation science camp as it's called, because there isn't really summer per se in Liberia the same way as in the US. And that is for high school students. So even though we're talking about post-high school medical training over a 7-year period, in discussions in the curriculum revision, many people, women and men, raised the issue of lack of preparedness coming into medical school. And so we started to design this science camp, and we've been intentional. That is absolutely going to have a 50% female admission requirement. It's also going to be intentional about recruiting males and females from the more rural, underserved areas of Liberia, who are also underrepresented across genders. And so I think that's a really exciting piece of the work. We're piloting it this year. Next year, it's going to be fully rolled out as I just described it. And that in particular, in my experience from the US, has been extremely well received. People are very excited about that. They recognize that there's a pipeline challenge. There are challenges all the way along the educational system, challenges for males and females. And then many of the women in leadership recognize, you know, from their own experience, as we've heard all day today, and certainly also from Dr. Don, that they experience unique challenges related to gender. So that piece in particular, we're very excited. And just today in the pilot, the students are moving into campus. I just got a picture on my phone a few hours ago of their little badges with their names. So, you know, we're really doing this, and I think this is going to be great. And the reception of it has just been terrific. That's an exciting piece of the work.
Fantastic. I'm hoping that you and Dr. Don can comment about how COVID has impacted various education and research programs. There was a question from the audience that came through, and you know, and whether or not remote technology has had an impact in any way.
Okay, thank you. For us here in Liberia, yes, COVID has impacted the education. Like everyone else, we had to shut down, stay home for some time. The University of Liberia decided to, with 20,000 students, the difficulty of social distancing and all that, so decided to do first an online training. Of course, we have people who call themselves born before computers, who are faculty members. So have to train all those ones before we could start. And still there are some who are not really very comfortable using the computer right now. We also have the challenges of the internet and even getting the equipment for some of the staff and students. The second semester, we decided to move into a blended learning approach. So about 60% digital, 40% in person. we still have challenges for that. So we have situations where students had to go on strike because they didn't think they wanted the online learning. They wanted the face-to-face because they didn't think the online can actually replace the face-to-face. But we are managing. As it relates to this program, we did the curriculum revision for the medical school digitally. We've met every week on Thursday with the US team digitally to discuss the work that we have done, get their feedback, their inputs, and then we go back to work and meet the next time to present what we have done, and that have gone so well. They've done some trainings for us also digitally, and that have gone so well. And now they have started to come back to do the face-to-face as well. We had the Vanderbilt team here about 2 weeks ago, and that also went fine. So life is coming back to normal. Thank you.
Thank you for that. Dr. Talbot-Slagle, have you been able to, can you comment on using remote technology? We've all been grounded for the last year and a half, and just commenting about how the nature of your collaboration has changed and how you've been able to make it work despite not being able to be in person.
Sure. I'm very much an in-person relational kind of individual. And so I think if you had laid out for me what we have lived through at the beginning and said, how do you think this is going to work? I might not have been terribly optimistic. But just as Dr. Don just said, it has been, this team has adapted amazingly well. You know, as she mentioned, we've had the opportunity to have these meetings. One kind of strange bonus, I hate to talk about this in any positive way, but at the beginning, whenever there were restrictions on patient care in Liberia, we were able to have more time with the clinical faculty because they were doing less in the clinics because of COVID. And, you know, that's obviously not a good thing overall, but it did help advance the curriculum revision. There aren't enough physicians in Liberia. They're always busy. As far as I can tell, they all have multiple full-time jobs. They're amazing. And so it's hard to get time. And that time was very helpful to the curriculum revision, and particularly on the clinical piece. That was a bizarre kind of side effect, if you will, of what was happening with COVID at the time. You know, we've adapted whenever we've done some work with, for example, we have a group of that we call teaching apprentices who are future faculty. I did some work with them on curriculum revision. And so we purchased some mobile data plans for them, which you can do remotely to enable them to have access to the internet so that we could meet remotely. And so that was a good pivot and a good adaptation. And I still deep down feel that teaching is better in person for sure. And I can't really comment on how the teaching was for remote learners versus how it was in person because I wasn't there. My experience on the US side is the teaching I did for remote learners was good, but not as good as it would have been if I'd been in the room with them. So I would imagine that there was, challenge all the way around there. But the ability to adapt and the flexibility of this whole team, whole US Liberia team, and just creative ways working around problems. And as Dr. Don said, doing workshops remotely, it's been remarkable in in its success, I would say, from my vantage point. Much better than I would have predicted had someone set out this scenario in advance.
No, it's wonderful to hear. I think similar to what's happened here in the US and the rest of the world, the impact of lack of schooling in person, the impact of remote learning, I think we're going to be learning what exactly that is in the years to come and how we can help students recover from that. Thank you. So from both of you, I'm hoping to hear what are your hopes and plans for the future of your collaboration between the institutions and between the two of you. Where do you want to go next?
Okay. This collaboration started with a project. That project identified needs, and we worked together, and we are working together to identify the needs. To address the needs. I believe that as we address the needs, there will be other needs. And so we'll continue to work together to address the needs. I don't believe that there will ever be a time that we'll have a perfect situation. So we are in it for a very long time. At the moment, Yale University is the prime. That is because we recognize our own weaknesses. I don't believe that USAID would have given us $15 million if the College of Health Sciences was the prime. There's no financial management system in place. There's no grant management office in place. There are very few people who can even design good programs in the college. So over the next 5 years, we are hoping that those capacities can be built. And then, so right now, Yale is babysitting. And hopefully after 5 years, we'll become teenagers, and then sometime we'll become adults, and then we can provide a leadership and we can continue to work together.
That's great to hear. I really am hopeful that University of Liberia will be the prime next time.
I
Dr.
agree.
Taylor.
Yes, I agree with that. Yeah, I like to, we talk about kind of supposedly working ourselves out of a job, which is, not how you're supposed to do it in academia on the US side. But I agree exactly with what Dr. Don said. And I see us also, Dr. Rostegar here at Yale is a very well-known pillar of global health globally and at Yale. And he always talks about taking the attitude of being guests in someone else's house. You are there at their invitation. They can kick you out at any time. And, hopefully you'll be invited back. And so I hope what Dr. Don articulated is exactly what happens. By the end of this 5 years, the University of Liberia College of Health Sciences is positioned to prime a large grant. And I hope that we performed well enough and followed their lead well enough that they want to invite us back to help on future work. But, we have to remember that we're guests and we have to earn the right and honor to be there. And so that's my hope that we continue to do that.
With that attitude, Dr. Talbot, I have no doubt that this is only the start of a long collaboration. So thank you for sharing. And is there any possibility or is there any interest? I know you guys are just at the beginning of this new work, but is there any interest from neighboring institutions or neighboring medical institutions in neighboring countries, perhaps in the West African Congress, that might be interested in taking some of the lessons learned from what you're doing and applying them to their own institutions in restructuring medical education?
Okay, like you rightly said, we are just starting. I believe when we start documenting our experiences and start presenting lessons learned and some of the successes with the program, we will be able to convince, or we'll get others who will develop the interests and we'll be able to move on with it. But during the design process, we also thought about that. And so we will actually work towards just getting our neighboring countries also building the interest in what we are doing. It was thought on from the beginning.
That's fantastic to hear. So we are looking forward to hearing more in the next few years about how this collaboration is evolving and the impact that you are both having, and look forward to updates, and hopefully you can share with us what's happening with your neighboring institutions as well. Thank you both for sharing your experience. Thank you to Dr. Barakat for being here with us and introducing the panel. And thank you to the organizers for having the opportunity today. Thank you very much, everyone, for being here.
Thank you for having us.
Yes, thank you.
So.